Hello, everyone, and thank you so much for joining us this evening. My name is Anastasia Spermuli. I'm the Director of Graduate Admissions here at Baypath University, and I'm going to pass things over to Lydia now.
Hi, everyone. My name is Lydia Sly. I'm a second-year Doctor of Health Science student at Baypath, specializing in advanced occupational therapy practice. I am pleased to welcome Karla Ehlers. She is our hot topic tonight in OTs is pelvic health, the basics, and our guest speaker is Karla. Karla has experience across many settings with a focus on pelvic health. She started her own women's health business, OcuPelvic Health and Wellness, which supports women with pelvic floor dysfunction. Throughout this presentation, feel free to submit your questions via the chat, and we will also have time for Q&A at the end. So now please help me welcome Karla Ehlers.
All right. Hello, everyone. Like Lydia said, my name is Karla. I am an occupational therapist, and the last 3 years I have been specializing in pelvic health. And I have been an OT for about 9.5 years. I met Dr. Julie Watson, the OTD director at Baypath at University of St. Augustine back in 2015. She was one of my, sorry. And I worked with her following graduation at, in Jacksonville through AOTA's neuro residency program. And so Julie's been a great mentor to me, and she reached out to me just last year to kind of talk to you guys all about pelvic health. And I hope through this presentation, you guys fall in love with pelvic health and just realize how creative it can help us to become as OTs, and how just deeply rooted in occupation it is, and just help you to think outside of the box and integrate it into your OT practice upon graduation. And so, like I said, I've been an OT for about 9.5 years, and I initially started off as an inpatient rehab therapist. I have a lot of experience in the inpatient therapy setting, and about 3 years ago, my husband, who's a physical therapist, we decided to do travel therapy. So we've been traveling for the last 3 years. He's been doing travel contracts, and I've been doing PRN work, and also working on my own pelvic health business. And so before I got into pelvic health, I became very burnt out. You hear that a lot. And so I found pelvic health, thankfully, and it just reignited my passion for OT. And so I hope that, like I said, through this presentation, you guys find some a setting or topics that you really can find something to spark your passion and just elevate your skill set as an OT. So there's a little lag on these slides here. Let's see if it gets going here. All right, so the objectives of this presentation. So you will learn about what is the pelvic floor and its functions, how does it fit, how does OT fit into pelvic health, the role of OTs in pelvic health across diverse clinical settings. You will understand a few common pelvic health diagnoses and the connection between pelvic floor health and functional daily activities. So these first few slides are going to be some education on what is the pelvic floor. A lot of our patients, our clients have no idea what the pelvic floor is. Like, it's this mysterious space in our pelvis that a lot of people don't know where the pelvis is, and if we can't see these muscles and these ligaments, these tendons, like, how are we supposed to correctly activate them? So a lot of the beginning of a plan of care for our patients is a lot of education, which is right down our scope of just empowering and advocating for our clients to improve their body awareness and to learn about themselves. So the three main functions of the pelvic floor, the first one is elimination. The pelvic floor is a group of muscles that you have to be able to coordinate. It has to be able to hold in urine and be able to then release and let go of urine and bowel function. So elimination is really important. The second one is intimacy, asking for permission to discuss these things with our clients and patients. And, the coordination of these pelvic floor muscles is really important for orgasming, whatever intimacy looks like for people. The third function is organ protection / I should have put support on there. So support and organ protection. So for example, when you take that first step when you're walking, that energy flows up from your foot, up to your leg, up to your pelvis. And if these muscles within our pelvic space are imbalanced, they're going to potentially cause some pain. We have to have that coordination that we'll talk about. So organ protection, especially for women, protecting the uterus, the reproductive organs, and our bladder, our rectum for males as well. So these muscles have a lot of support that they're doing for us. In addition to, they're at the base of our spine, right? And our 10-pound head is sitting right on top of all of that. So there is a lot of support that is, our pelvic floor needs to be strong and buoyant and reflexive. It's really impacted by our nervous system, which as OTs, we love talking about the nervous system. And so just discussing these topics with our patients, that may impact them with whatever issues that they are dealing with. So what is the pelvic floor? So that this is something we talk with our patients a lot about is, it's a group of muscles within our pelvis. There's the pelvic space with the bones, which creates like a bowl, the muscles, which create a hammock right underneath at the base of our spine. There's ligaments and tendons all within this pelvic space. And so as an OT, I don't really go into like, oh, this is this muscle, I'm really relating it to function. And so in these next few slides, we'll bring up some more functional education about this, but the pelvic floor. So the first topic is finding the bony landmarks of your pelvis. So I want you guys to do something with me. If you're sitting down, you probably are. I want you to put your feet on the ground. Let's get grounded here a little bit. Our feet are on the ground. You're sitting on your sits bones, on your glutes here. So let's take your hands, okay? Take your hands underneath your bottom on each side. And so this is one of the first things I do with my patients is finding this space, using our tactile sensory system, improving body awareness and proprioception, right? So taking your hands, reach underneath your bottom. Do this with me, come on. So you're on your sits bone. So this creates a diamond, right? You see the diamond on the screen. So the sits bones are on each side. So we're literally shifting side to side. You feel these sits bones, okay? Left and right, okay? And then we're going to the pubic bone and the tailbone. That's going to be the front and back part of the diamond. So quite literally, take your hands, put your hands on your belly button, go down a little bit farther, find that pubic bone. It should be right on like the middle part of your finger. You're going to take your other hand, reach around the back. You can't see them on screen, but put your other hand on that sacrum. Go down a little bit farther. Right on the base of that sacrum is your other hand. Go down a little bit farther is your tailbone. Okay, so that's the front and back of your diamonds, of your pelvis. So we're just shifting. We can use some fancy lingo because you guys are all therapists. Anterior pelvic tilt, posterior pelvic tilt. We're learning these movements within our pelvic space here, right? And so kind of figuring out this diamond, this is where these pelvic floor muscles are all attached to. Okay, these are the attachment points. And so orienting them to this space is so important. So that's one of the first activities, bringing some awareness that you guys can do. So I do this for almost all my patients that I'm working on pelvic health with. All right, so next is more of like a breathing assessment. So let's try this now. I want you guys you're still kind of grounded, your feet are on the floor, we're sitting here. It's kind of the end of the day. So let's just take a deep breath in through your nose. Do this with me. This is nice. And exhale out your mouth, okay? What do you feel? I want you to put one hand on your chest. Can't see on my screen, other hand on your abdomen. Take a deep breath in through your nose and out through your mouth. So we're doing this with our clients. This is kind of some good co-regulation between us. We're regulating our nervous system through taking breaths to activate our parasympathetic nervous system. That's our rest and digest system, right? And so taking these deep breaths, trying to bring some awareness. Now, where are they feeling this breath? Where are you guys feeling this breath? Is it in your chest? Feeling more chest breathing? You know, or are we is it, you know, using more of this upper neck to breathe? You know, that can be kind of a key in for you. Like, using your flight of too much, you know, upper chest breathing, we're not getting deep enough breath to activate that diaphragm to tap into that parasympathetic nervous system. So what are you feeling? You know, are you feeling movement in your upper chest? Are we feeling rib cage expansion? You know, we can also, you can put your hands around your rib cage. This is something I do with my clients. Inhale, feeling that rib cage expanding 360 degrees into this web space on your hand. Are we getting that expansion? And then, do you feel anything in your pelvic floor? We'll get into this. A lot of them aren't. A lot of people don't, they've never talked about their pelvic floor. We don't know where our pelvic floor is, right? So what is it? So are you feeling a connection to that pelvic floor with your breath? Because if not now, but you know, after this session, after sessions with your clients, they will begin to kind of feel those muscles down there after incorporating some of these strategies. Okay, so the abdominal canister, the core pelvic floor system. If there is one thing that you learn about pelvic floor health, this is like one of my biggest when I learned this. This is like the foundational piece of pelvic health. So our inner core consists of our diaphragm, multifidus, transverse abdominals, and your pelvic floor. All four of these are required to, you know, stabilize our spine and our pelvis, to create and regulate pressure, to regulate the nervous system. Now, I already kind of talked about like getting that deep breath in. We need that to get out of that sympathetic drive that all of us, everyone, especially our clients who are in the hospital, they're in the clinic for, you know, these medical issues that they're already kind of ramped up or maybe even depressed, you know, like, so the diaphragm, working on this inhale in through the nose, that diaphragm is going to come down and get into that parasympathetic nervous system. The multifidus is working on stabilizing the spine. And a lot of people, you know, we are over gripping those multifidus muscles. We have a lot of back pain. There's a lot of tension there already. The transverse abdominals, these are, you know, a lot of people think of our core as just like those six-pack muscles, but the transverse abdominals are really important to help stabilize the pelvis. If we're too much into that anterior pelvic tilt, working on those transverse abdominals to kind of get back into a neutral position. And then, of course, the pelvic floor that we'll talk more about. Okay, so the core pelvic floor system. So we already talked a little bit about the breath. So we're going to work on that air in, inhale down, so that diaphragm comes down, abdomen and ribs expand, and that pelvic floor gently descends down on that inhale. And so this is what we consider our reverse Kegel. You've probably heard of Kegeling. That is a pelvic floor contraction. And so that is, you know, on the right side of the screen, the air out, the exhale up, that pelvic floor contracts and goes up. I was going to mention this earlier, but part of our pelvic floor, there's 3 layers to the pelvic floor. And the deeper, the more strong contraction you can get is the deeper the layer. You can think of, especially for women, your pelvic floor is like an elevator. For men, it's kind of that rectum area is like an elevator. The deeper the contraction, you go up to level 3. And then on your inhale, you're going down to level 1 and potentially the basement to get that relaxation down. So this air in, inhale down, a lot of patients have never heard of this before, or they are breathing opposite. And that is called pelvic floor dyssynergia. And so you'll, even just doing your breathing assessments, you can do this while they're sitting in the clinic right in front of you, or in the hospital, sitting edge of bed in their wheelchair. You know, check out their breathing, assess their breathing. On their inhale, do you see their abdomen coming out? Or on their inhale, do you see it going back in? You know, that's kind of opposite of a breathing pattern. So, you know, if they are doing it opposite, you know, if they're inhaling and their diaphragm is not going down, you know, think of what that does to our bowel system. You know, that inhale, that diaphragm helps to massage our bowels and helps to get things moving. So if you're breathing the opposite, the large and small intestines are not getting that massage, so that can lead to constipation. Additionally, you know, if we're not getting that reverse Kegel on that relaxation, we're just constantly in this contracted state. Okay, so that can lead to a lot of pelvic pain. So you'll hear, you know, on social media and different things like, stop doing Kegels, and it's because a lot of women, or even they'll hear from OBs or just any, you know, general education is, oh, just Kegel, you're fine. But a lot of women and men as well, they don't need the Kegel. They don't need that pelvic floor contraction. What they need is more of the relaxation down. And so assessing that is really important. And there's different ways to do assessments, whether it is if you get training on the internal vaginal rectal exam, or you know, I'll go into some courses that if that's not something you're interested in, there are different, like a menu of options for clients to and patients to, for you to help walk them through this very thing, is that an internal exam is not always necessary or even advantageous for the patient, because if they have some trauma, or even if they are kind of more older geriatrics, like a lot of them are interested in an internal exam at all. So using these strategies for building awareness of their body and using your own assessment tools of visualizing, feeling, and helping tapping into this body awareness. This is a really big piece. So moving on. All right, so let's see, let me go back one. So with this pressure, so this is this system of improving intra-abdominal pressure. That's what that next slide was about. But so if you know, you're inhaling through your nose, that pelvic floor is going down. And so if, like, for example, if you see patients in the hospital or even in the clinic, you know, they're going to get up and they're leaking. You hear that all the time. And a lot of that is due to this this intra-abdominal pressure management. And so teaching them these breathing strategies of, I don't know if my cursor can be seen here on the right side. So this exhale up. So we'll get into this a little bit more, but stress, urinary incontinence is probably one of the biggest diagnoses that we'll see. And so a lot of that is related to managing that pressure. And so if the pelvic floor muscles are weak and they are going to stand up and that pressure is going down, of course they're going to leak some urine because they haven't recruited the correct muscles to hold that urine in, if that makes sense. And so this intra-abdominal pressure, so like I said, it can result in stress urinary incontinence, where there's a stress down on those pelvic floor muscles, and those pelvic floor muscles haven't learned how to incorporate correctly. There's pelvic organ prolapse. This is common with women, particularly after a vaginal birth, not always, but there's weakness in the pelvic floor muscles, and there's maybe a little bit of a prolapse of one of their reproductive organs, the uterus, potentially the bladder, or even the rectum, where it's kind of protruding down a little bit. And so this is something where, as an OT, I'm looking at not only this musculoskeletal system, but from a whole body approach, the biopsychosocial approach, especially for this pelvic organ prolapse. Like, you'll see people who have Googled it and they go down the rabbit hole of, oh, I have an organ falling out of me, you know, like just saying that alone just kind of ramps up our nervous system, gets us really upregulated and kind of in our head. And so that's a lot of education and you know, working on tools to regulate their nervous system, and working on anxiety strategies for that, because it can be kind of scary if you aren't informed. And so a lot of this is education and, teaching women and men about their diagnoses as well. And I do refer a lot to women because that's primarily the clientele that I work with, but a lot of this, I have some clients who are men, but it's primarily women. But and talking about the biopsychosocial lens is for men, they feel even more embarrassed than women. So there's not as many men coming out talking about some of these issues because they are embarrassed. But I would encourage any therapist to really look into the men's health space too, because they definitely need support as well. So also this intra-abdominal pressure regulation. So that can affect a diagnosis called diastasis recti. So that's primarily in women who are pregnant, that linea alba along the front midline of their abdomen, it gets a little bit spread. And if we're constantly putting pressure through that, it can kind of get worse. So working on different body mechanics, ways to fully activate those core muscles. Like I said at the bottom of this screen, the overall inefficiency of activating this core and pelvic floor muscles is causing this intra-abdominal pressure dysregulation. Okay, so I created this little flow chart. It was initially for a in-service I did for an inpatient rehab, but when I was making this presentation, I was like, this can be useful for different settings. And so let's see. Sorry. When you're working with clients, this is particularly for, on this left side of the screen, the non-neurogenic bowel and bladder population. So that is a completely different topic training. I've not done a ton of that. That is primarily like with spinal cord injury patients, people with MS. That is a specialty area for you to look into as well, especially if you're going to be in like a neuro inpatient rehab facility. We would be like the go-to people for that. And I have some resources at the end that if that's something you're interested in, furthering your education for that. So this guide to addressing continence. Continence is your ability to hold in bowel and bladder when you want to go, and letting it go when you want to. So this is kind of a flow chart here. So you're going to first ask yourself, can the patient follow two-step commands? So a lot of this training and education, the client has to be cognitively intact. And they do have, I don't have this on here, but they do have to have some motivation as well. So maybe they can follow commands, but they're just not interested in about this. They've been using Depends for years, and it's just not important to them. I can remember when I first got into this, evaluating a woman who had brought her own Depends from home. So that clued me in right away, like, oh, she already, this is in the inpatient setting. She already, we're looking at these clues, like, does she have her own Depends? Is she bringing her pads from home? Like, that already tells me there is probably some issues already. So, and I had wanted to really work on this stuff with her, but she didn't care, so, as much as we really want to, it has to be client focused, and it has to be focused on what they want. So that's a little caveat. So, can the patient follow two-step commands? So we're going to look on the right side of the screen. First, start out with, this functional continence. This is something that as OTs, we and PTs are already working on. This is like our bread and butter already, this functional continence we're working on. And we'll get into that in a little bit. But so no, if they can't follow these two-step commands, we're going to really focus on caregiver and family education, improving their functional continence. And so what this looks like with caregiver education, I think a lot of you OTs, we're already doing this. We're working on educating hospital staff, caregivers on, recommending every 2 hours during the day, getting them up, getting them on a toileting schedule, focusing on, just functional nutrition and fluids. If people are having trouble getting up and going to the bathroom, what's one of the first things they're going to limit is their fluid intake, right? But that's going to cause a dehydrated bladder, and a dehydrated bladder is going to make them have increased frequency and cause dysregulation already to their bladder. So focusing on educating on importance of fluids and nutrition. I'm talking to the nursing staff or even the patients and their family members on fiber intake. Like if they're constipated, a lot of people are just straight to go to Miralax or just different supplements, but seeing like what is their nutrition like, how can we incorporate some fiber into their diet. And then for these patients who cannot follow commands, what is their morning, day, evening routines like, especially for bowel health, our bowels really like routine. So, a little caveat for like spinal cord injury patients, getting them on a bowel schedule, like every morning at, 8:30, maybe it's you're getting them started, or even the CNA, they're getting on that bedside commode. For patients who are not cognitively intact, talking to the family about getting them into their bathroom at a set time each day, that can be so beneficial. And that's our bread and butter, are these routines. Like we love these routines, and just we're the only ones like really focusing on this, and that's our specialty, right? And so on the right side of this screen, this improved functional continence, this is what we're doing already. We're addressing their strength, their balance, their dexterity. Can they get to the bathroom? A lot of people, if they can't even get to the bathroom quick enough, it's because of strength or a gait issue. So, collaborating with physical therapy on those things as well. So this alone, you're already like a pelvic health OT working on these things, and we're already doing that, right? And so the next caveat is, can they follow 2-step commands? So we want to ask, yes, they can. They're motivated. They want to work on these things. So we want to ask ourselves, what type of incontinence do they have? So we talked about stress urinary incontinence, and for the time of this presentation, that's kind of what we'll mainly focus on, is this stress urinary incontinence. So we're addressing that intra-abdominal pressure, that breathing strategies. Are they putting pressure down on their pelvic floor? More than likely they are. And so we're building awareness of this. We're improving their inner core strength. Those are all things we can do without even an internal exam. Right? We can do this on an inpatient setting. We can work on these things. Another type of incontinence is urge urinary incontinence. So this is where they are going to the bathroom and frequency. They're frequently going to the bathroom. The average number of time most people go to the bathroom each day is about like 6 to 8 times a day. So if they are ringing their call light, or if they are telling you at home they're going to the bathroom, every 30 minutes or less than that. At nighttime, they're getting up every hour to go to the bathroom. You want to, first we need to see, we need to rule out a UTI. So having them get a UA, a urinary analysis, seeing if there's a UTI, because that's a symptom of it, right? So if there is a UTI, they're going to need antibiotics and do the medical management for that. There's not much we can totally do, giving them tips for improving their hydration, things like that. So if the UTI is negative, which hopefully, it is, and this is something we can really work on, we're working on bladder retraining strategies. So I'll literally if this is inpatient or even in the clinic, have a water jug and say, this is your bladder. Our bladder is made to hold urine. It's made to do its job. And if you're going pee constantly, that bladder is not doing its job. And it's frequently sending these signals up to your brain that you have to go pee. And so, educating them on the goal of the bladder is to fill up. And so what that looks like is, figuring out if there are bladder irritants that, are they dehydrated? Are they only drinking coffee and caffeine? We're doing I have it on here, avoiding log of like a bladder diary. This is like, these are all behavioral strategies, right, for OTs. And so this, you know, there's different forms you can give to them for them to go home and fill these out and bring it back to you 2 or 3 days later. And it shows you, it gives you insight into, you know, how many times a day, it's objective, how many times a day are they actually going, what is this urge like? So you can do this on the inpatient setting if they are cognitively intact and are motivated to work on that. I've done that in the hospital setting. And it gives me information. I can tell the doctor, like, hey, like, the UTI was negative, you know, they're going to the bathroom every hour, you know, and so these behavioral strategies, we're teaching them urge suppression techniques. And so what that looks like is like clicking, sorry, my air conditioning just turned on. Let me turn it down for a second. I don't know if you guys can hear it. Okay, it was really loud to me. I don't know if you guys could hear it, so I turned it down. So urge suppression techniques, so suppressing that urge, you know, these are all behavioral strategies, you know, like counting backwards, singing a song, getting their brain off of that urge. A pelvic floor contraction can inhibit that urge. So if they know how to do a contraction, you know, you can work on squeezing your knees together, that can facilitate it. You know, doing ankle pumps back and forth, different things like that. So urge urinary incontinence, that's one you'll see a lot as well. And then, like I said, we talked about functional incontinence. This is something we are already working on. And so incorporating that maybe a little bit more to your plan of care. So yeah, so this is kind of just a flow chart that can help you to kind of figure out a plan of care for your patients. All right, so how does OT fit into pelvic health? The OT practice framework. I hope you guys know this. This is like our Bible of OT. I love the OT practice framework. And so I'm gonna go to the next slide because it's the same thing, just maybe a little bit bigger. Maybe you can see this a little bit better. But the OT practice framework. So how does pelvic health fit into the OT practice framework? If we look on the left side of the screen, the occupations, ADLs, toileting, yes. You know, bathing, whether maybe they're having incontinence, you know, in the shower. I've had that before, you know, all these different ADLs, talking with our patients about what is impacting. Dressing, if there is somebody who has what's called vaginismus, maybe some different fabrics are affecting their vulva area. You know, those are all things that we are specialized to focus on. IADLs, like this is one that is so impacted, especially like with our geriatric population, where they're afraid to go out to the grocery or to a restaurant because they're afraid of having an accident. You know, how isolating is that from a, you know, a psychosocial standpoint? Health management, this is also like very broad, but I'm thinking for women with endometriosis, like this is like a chronic illness that they have. You know, how are they managing all of these doctor's appointments and the testing? You know, what's that like for their nervous system? Rest and sleep, you know, are they waking up every hour to go to the bathroom? How can we help with that? Or are they constantly perseverating on their pelvic pain and can't sleep? Rest is a big one. You know, in this day and age, so many people are just constantly go, like truly, how are you resting and getting into that parasympathetic state? And so just me kind of taking a breath right now, because I'm kind of hyped up to do this presentation, like I'm noticing that within myself, like taking a breath and noticing within themselves, like bringing this education to the nervous system. Like, are you actually giving yourself true rest? Or are you a mom that has a busy schedule with kids? Like, how are you filling up your cup with self-care? And, you know, self-care is our bread and butter, you know, really truly looking at how are they caring for themselves, self-care. Education, I'm just thinking of a young girl in school, like she just started her menstrual cycle. prepared? Does she know how to track that? I have a client right now that I'm working with who is, she's 14 and she has bipolar. So we're working on nervous system education and training, and during her luteal phase, that's when a lot of her symptoms arise. So like finding strategies to help with that. Work, you know, it comes back to, you know, if they're leaking urine from picking up something heavy, you know, that stress intra-abdominal pressure, that stress urinary continence. I'm also thinking of women with endometriosis. March is Endometriosis Awareness Month, so that's kind of on my mind for endo. But you know, women with this chronic issue, like a lot of them have trouble holding a job because they are in pain, and you know, working on you know, working through like what could be good for their job, you know, to improve their independence with that task. Play, you know, like, no, this is, you know, this does not just have to be for pediatrics. I haven't really talked about peds too much. I don't have a ton of really experience with that, but this pediatrics is for sure. There are pediatric pelvic health OTs, and like that is a major specialty, a major niche that if you're interested in peds, I would definitely look into specializing in pelvic health. So for kids that maybe they are getting very hyper focused on a game, and they don't have that interoceptive awareness to know when they have to go to the bathroom, so they're having incontinence that way. But not even just children that to play, like adults that are just very type A and just working. How are they playing? Like, what is their nervous system like to be able to get into this rest and play? And you know, this is kind of a nervous system term, is that ventral vagal state. This is polyvagal theory. This is a big nervous system theory. You know, getting into being able to tap into that parasympathetic nervous system to truly enjoy themselves and have fun, because that is really hard for some people. Leisure, kind of similar to play. Social participation, I mentioned like some of those IADLs, but you know, just social participation in general, like intimacy with their spouse. You know, what is that relationship like? You know, thinking of menstrual cycle tracking and having them, you know, coordinate activities towards like during their ovulation or follicular phases, so that they have more energy during that time. Like, what does that social participation look like for women? So those are all, you know, all clues there that are ideas to work on. So context, environmental factors, you know, I'm not going to go into all of these, but like using your creativity and thinking of, you know, for urge urinary incontinence, these environmental factors, like they might tell you that, oh, every time when I get home, I put the key in the door, I have to go to the bathroom. That's a behavioral kind of maladaptive behavior that they've learned. And so, you know, just bringing awareness to that is huge. Let's see, I'm trying to think of any other environmental factors. You know, just, you know, this is really big right now of, you know, foods, like things that are in our foods, you know, that are causing maybe more of a GI upset with different products and things. So going on to these performance patterns, you know, habits, you know, habits and routines, like working on from a musculoskeletal perspective, like, are they gripping? Are they, you know, holding tension in their abdomen or their glutes or even their jaw? Like, our jaw is really connected to our pelvic floor, that like through our nervous system, you know, so asking them and having them clue in through body awareness of where these tension patterns are and habits, you know, so just bringing more mindfulness into different self-care tasks, like as they're standing at the sink, like where is the weight bearing in their feet? Are they primarily on their heels? And that's causing a lot of tension up the posterior chain. And so it's no wonder that they might have some posterior pelvic tightness or pain in their glutes, because of that habit of just kind of primarily being on their heels, on their feet. You know, roles and rituals, you know, as, you know, students, mothers, CEOs, like what are those daily roles that they are participating in, and how is that impacting them emotionally? What else? So under performance skills, motor skills, we're obviously looking at posture, process skills for some of these like chronic injuries, like how are they organizing these medical appointments? How are they staying consistent with their home exercise program? Because, you know, for chronic pelvic pain, chronic constipation issues, it's so easy to fall into our normal habits. And so are they able to stay consistent, or do they need some of that accountability? Social interaction skills, just kind of thinking of, you know, do they get embarrassed, or, you know, what's their support system look like? And then going on to the right side of client factors, this is a really big one. I'm in Lindsay Vestal's trauma-informed pelvic health certification right now. So, you know, what are these beliefs that people have about themselves that they just can't let go? You know, and is it due to some kind of past trauma? So that's additional, you know, training that you would need. But in addition to, you know, focusing on body functions, you know, I mentioned the biopsychosocial approach. So not just taking that musculoskeletal approach that it's so easy to kind of fall into, you know, but, you know, looking at the posture and all of those types of things, but also, you know, nervous system wise, I've talked about that, like that is huge. And I really think that leaning into that system is one of our unique skill sets as OTs. You know, how is that affecting them emotionally, mentally? And then of course body structures, kind of as far as the posture, and is there truly some kind of imbalance, and different things like that. So this is the OTPF. Like if hopefully this gave you guys some ideas and to get things kind of clicking in your brain. So we'll move on. So after all of that, hopefully you can find some kind of connection between pelvic floor health and functional daily activities. So, you know, what's it look like for just opening up the fridge and reaching in to grab something? Are they gripping their glutes? Are they just working on moving at their spine and we're not getting much, you know, hip hinging? You know, looking at those types of things. What are these daily activities? And it's totally connected. It's all connected. And as OTs, we're looking at this from a whole body approach, right? Not just this little muscle right here, but how is it affecting them functionally? So yeah, we're making it functional. Like this is a perfect example of squats. Squats are like the most functional movement we're doing throughout the day, to get on the toilet, to sit on a chair, to go to school and sit on the desk. You know, this is so functional. So really working on, I mentioned that stress urinary incontinence, where they go to stand up and they're leaking. So, you know, cueing them to, on that inhale down, we're thinking of that pelvic floor relaxing down, that reverse Kegel happening. And then on that stance, they are contracting their pelvic floor. It's kind of reflexively, it's happening. But then as they stand, that you know, the external anal sphincter, the urethra is activating to hold that urine in as they go to stand up. So breaking down that sequence of movement, you know, this is something we are so good at, is this activity analysis, right? Analyzing these activities, really breaking down these movement strategies and figuring out what is happening with their breath, you know. So, you know, finding out what movements they're doing, what activities they're doing that are causing some sort of dysfunction, and using our own activity analysis to break that down and help them. Okay, so the role of OTs in pelvic health, we already know, like I've went through all these different amazing things that we can do. So across the lifespan, you know, we can work in pediatrics, we can work with adolescents, we can work in preconception, pregnancy, postpartum, perimenopause and menopause, and geriatrics. You know, a lot of these, you know, like for the pregnancy, postpartum, menopause, that's obviously, women's health, but this is all also applicable to male pelvic health as well, especially like I have a couple one patient right now who is he has Parkinson's and constipation. Like that is a really big need for these patients with Parkinson's, is addressing constipation as well. So across the lifespan, we can work with these patients, and then not only across the lifespan, but in so many different clinical settings. I guess you would probably think of pelvic health, as an outpatient clinic. Like that's definitely a very niche specialty. You need additional training. Maybe some of you might have the option or opportunity to have an internship. Like that is amazing if you can get an internship in outpatient pelvic health setting. But if not, a lot of these strategies that we just talked about, you can incorporate them into your acute care job or internship, especially with just general acute care, but asking the acute care staff, do you guys have an OB ward? How are your postpartum women, like how are they doing? Are they getting support? This is something we can work on as far as cesarean, scar massage, and working on that intra-abdominal pressure when they go to get up. Are they putting pressure on that scar? And then postpartum for a vaginal birth, working on that pelvic floor muscle retraining, and then just body awareness, and thinking of posture, like if they are constantly holding baby, what does that look like? You might be having that forward head, rounded shoulders. A lot of these muscles are going to get tight, and that can impact your pelvic floor too. So there's just so many ideas we can work on. Inpatient rehab, I've kind of talked a little bit about that already. There's, we can work on, if people are trying to get off of a catheter, the nursing staff is going to be doing bladder scans, and teaching them, how to connect to that bladder, because when that catheter's in there, their bladder is pretty much shut off. Those muscles are shut off for weeks. And once that catheter is out, helping them to reconnect to that area, working on that deep breathing to relax that when they're trying to void. Mobile therapy, this is one of the I'm an independent contractor for a business that I do mobile pelvic health. This is really good for, all populations, particularly postpartum women, if they're having any kind of leakage or nervous system issues, or postpartum depression. Like we can really focus on going right to them, and they don't have to worry about getting in the car and traveling, so that's a really big area. Skilled nursing, this can be a lot of education and for the caregivers, working on toileting programs, different things like that. In the schools, talking with the teachers, like how are they doing with their toileting as children, or even adolescents with their menstrual health, talking with the school nurse, like what kind of handouts do they have to give to these young girls that are just starting out with their periods. Like those are all ideas. Long-term acute care, you can think of these patients who have been on vents for a long time. We talked a little bit about the diaphragm. If they haven't been breathing on their own, that diaphragm is probably not getting a good, contraction down, and what's that doing to their pelvic health. So also a lot of caregiver training, like toileting schedules for that population as well. And then in addition to telehealth, I do a lot of this, a lot of education and training for women with pelvic issues already for telehealth. There's so much we can do by educating the client to learn about their bodies and become more aware of symptoms and behavioral strategies. We can definitely do that through telehealth as well. So this is the role of OTs in pelvic health, across the lifespan and across diverse clinical settings. Okay, so with all this information, what are the next steps? So I am going to encourage you to get curious. Like, what are your interests? Like, did any of this seem fun and exciting for you? Is any of this you're doing already? Like, there are one of the big things I think that came out of the pandemic was there are courses for everything, and that can be a little overwhelming, but there are continuing ed courses for any kind of topic. And as therapists, like, take advantage of that, because there are a lot of skilled therapists that are wanting to help spread this education. And so get curious about what your interests are and how you can help people through this unique lens of OT. And so there are Facebook groups you can join. The one that I am pretty active in and enjoy a lot is the OTs in Pelvic Health with Lindsay Vestal. She is the owner of Functional Pelvis. She has a ton of like 3 different courses and a lot of resources. There's a ton of information. She has a podcast as well. Another Facebook group is Essential Pelvic Health Education with another OT, Laura Rowan. So these are both OTs that are creating wonderful content for OTs. There's another, really big space in pelvic health. It's called Herman and Wallace. There are, I think, a couple OTs that maybe present continuing ed courses there, but I would encourage you to, if you're going to do a course, really look into who the instructor is. Is it an OT? Are they going to have that unique lens that we have? Or is it going to kind of primarily be more of a musculoskeletal approach, which nothing's wrong with that. We need to have those skills, but these Facebook groups and some of these OTs, I've just really fell in love with their approach and just really resonate with how they are incorporating our occupation-based lens into pelvic health. And so, let's see. Go ahead, come on screen. Okay, oh, there should be, okay. I think we're getting, all right, so this is good. This is a good screen. This is fine. So continuing education, like I mentioned, takeaways are we don't need to have, there's not a specific certification yet. Lindsay Vestal is creating one. It's not mandatory. You can take some of these strategies into your job tomorrow and incorporate it. You just have to have clinical competency to show this. And so I encourage you to do continued education. I actually made my acting debut on MedBridge with Lindsay Vestal. She created this step-by-step teaching your clients pelvic floor range of motion. That's on MedBridge. If you guys, a lot of companies will give access to that. And that's one that I'm actually in. So that was really fun to work on that project with her. So additional support and mentoring, finding like-minded clinicians, are there any other students in your class that are interested in things that you want to work on as well, like collaboration and just talking it out, like that can be so helpful. Hopefully, if you're interested in this, maybe you can find an internship, like that would be so amazing to get that support. Different mentorship calls with therapists who have experience, that's a good way to get more mentoring. And then there's a OTs and Pelvic Health Summit that Lindsay Vestal through Functional Pelvis, they host. This is like the 3rd or 4th year that they've done this. It's down in Phoenix, Arizona. I went last year, but that's happening I think in September, either end of August or September in Arizona. So that'd be great if you go. Like, I'm gonna be there. I already have my ticket, so come chat with me. I would love to meet you, and let me know if you went to this webinar. I'd love to chat. So those are all different next steps that you can take. I have another slide here. Oh. Okay, let me go one more. Thank you guys for, I have something to show you. So I have a guide that I created. I mentioned Lindsay Vestal. She has a ton of content out there for OTs and pelvic health. I helped her on a project. We created this guide to pelvic health, OT based on populations and intervention styles. I would encourage you to get out your phone, take a snap of this QR code. It has resources for different CEUs and podcasts. Like, I have listened to so many different podcasts and gotten knowledge from that. There's so much content out there, guys, like so much that you can like dive in, get curious, find some topics you're interested in, because there are a ton, and this guide can help with that. So we can give a second for anybody that needs that, and that should be my last slide. So I think we might have any questions.
All right, so it looks like we have a few questions. One of the questions is, what are some of the things to keep in mind as an undergraduate that is planning to become an OT?
Undergraduate planning to come in OT. Yeah, I love that you have so many things ahead of you. So, you know, kind of, you don't need to really specialize in anything yet, but just know like there are resources out there to further your understanding. Like like I said, find some podcasts that you're interested in, get a jump start on some of this education and finding resources that pique your interest. Join the Facebook group. You don't have to totally already be an OT. That's for OT students as well. So I would encourage you, like I said in the other slide, like to get curious and you know, just stay interested in finding topics that are of interest to you.
Another question, let's see. Is there something to consider if I'm a male and I'm interested in this? Should I not do it?
No, I mentioned that a few times about, you know, I primarily do work with women, but I have a couple of male clients that they need pelvic health. And, you know, there might be some men who would prefer to talk about this type of stuff with another male. And so, you know, kind of figuring out interests that you have and running with that. So no, don't feel discouraged at all. You should like go for it. Like what you're an OT. There are things you can work on, and you know, and across any setting, like inpatient, you know, there's, you know, all of our patients are having these toileting issues. So just having a few strategies and understanding of these systems can really just elevate your skill set. So yeah, go for it.
How do you
And
develop?
on that, one more thing on that guide that I'm sharing with you guys, there are some different resources specifically for male health as well, male pelvic health.
Thank you. Another question is, how do you develop clinical competence in pelvic therapy when there's no official training and it's not covered in many OT programs?
Well, stay tuned. There will be a big push for this in different programs. And developing clinical competency there, you know, I would really encourage you to take some of these continuing ed courses. It's kind of a part of like how informed you feel. You know, there's you know, when you work in pediatrics, there's not a specific pediatric certification you have to have. There's not a specific geriatric certification I need to have, you know, to work with this population. It's so ingrained in our lens that, you know, if you're specifically working on, you know, an internal exam, yes, of course you need to take a course for that. And there is no specific certification yet, but Lindsay Vestal is creating, or she has created a certification. So if you truly feel like you want to have like a quote unquote certification, look into the functional pelvis, because she has created one. It's not mandatory, but she knew that therapists are wanting that. So yeah, I hope that answers your question.
We have a few more questions. All right, we have a few more questions.
That's fine.
Any experience with caregiver training to support development of toileting independence in toddlers or children with developmental delays?
That's the big one there. So let's see. Children with developmental delays, pelvic Okay. So a lot of it is you're going to, I don't personally work in pediatrics, so there could be someone that has a more specific intervention, but just what comes to mind is just right off the bat, like what is their nutrition like? What is their intake like? First of all, like what is the dysfunction that they're having? Are they constipated? Are they not, are they having bedwetting issues? It's hard to give an example of a strategy for that, but a lot of it is going to be caregiver education. And so, what does that look like from the client or the caregiver's understanding? Like, are they aware of these, or is there more education you need to provide to them to say, okay, they're peeing or they're urinating how many times a day? Like, are they giving you objective information? So I would start there with, kind of honing in on, do they need to do a bladder diary? Can they give you some objective information? Or maybe it's even like some sort of sensory issue where we're building awareness of their interoception. There is an OT named, I forget her first name, her last name's Mahler, Mahler. She works a lot with interoception. That's on that guide that I have for you guys as well. So a lot of it is that education to the caregiver on what is their understanding of this situation, like how much information can they provide for you.
Thank you. 3 more questions. Aren't PTs often the ones that do pelvic health training?
Yeah, so there are a lot. I mean, that's primarily been in the past, physical therapy. And so it is a really good collaboration. And I would really encourage any OTs that are wanting to do this to talk with physical therapists. And, we can bring a unique skill set to this. And there is a guide that Lindsay Vestal created, was a PT's guide for hiring an OT in pelvic health. She has that in her Facebook group. So like showing that what our unique skill set can be just as advantageous to these clients, and honing in on your unique skills. Like for me, I'm really dive into the emotional regulation and the nervous system component. And for some physical therapists, maybe they don't feel as skilled in that. Maybe their biomechanical skills, manual skills are much greater. So it's understanding like what are your what are you really good at, what are you really interested in, and yeah, I mean, yes, a lot of it has been mostly PTs, but there are almost like 7,000 people in Lindsay Vestal's Facebook group of OTs and pelvic health. So I would not let that discourage you, because it's definitely becoming more wide known.
Would you recommend the PCES certificate? Also, do you find Pilates-based exercises can help?
Yeah, so the PCES certificate is a pregnancy and postpartum corrective exercise specialist. That is a certification I got a couple years ago, and yeah, I definitely recommend it. It's given me a lot of ideas for exercise-based interventions, and especially for the pregnant postpartum clients, which that's one of my ideal clients that I work with. So yes, I definitely recommend it. And what was the second question part of that?
If Pilates exercises can help.
Oh, Pilates. Yeah. I do know an OT who is a Pilates instructor. She has her own Pilates gym, actually in Colorado. So she's incorporating it. That's something to know, that if you're focused on pelvic health, is for people to kind of have a good understanding of their body awareness. And a lot of Pilates is that contraction of those muscles, strengthening those muscles, and for them to understand that if they're having more of like pelvic pain, or something along those lines, that all that contraction of the muscles, we might need more something restorative, or just different exercises that are targeting the correct muscles. So it can be a good adjunct if you're providing the right cues and they have a good understanding. So I mean, any kind of movement-based exercise, if they're having some sort of pelvic dysfunction, we need to be providing the correct techniques and skills and verbal cues and tactile cues to facilitate proper movement strategies.
All right, and the last question of the evening is, when I was shadowing a provider, they had mentioned that in Europe, they evaluate for pelvic floor health postpartum, but we don't here in the US. Do you potentially know why? And do you have any ideas how to make this practice more common?
Well, I would say in the US, it's definitely happening. Is it, automatic? No. That is a big push. There's a physical therapist by the name of Rebecca Seagraves. She has done a really good job of advocating for OTs and PTs in the OB space, postpartum in acute care. So do I know why it's not happening? I think it's just a lot of education. Through the pandemic and within the recent years, there's been a lot of more education that's been put out there in the women's health space. And so I think it's just a trickle down effect that we just, as practitioners, if you know that that's something that you want to look into, or if you already have a skill set for that, if you're working at a hospital, talking to the director, talking to the OB doctors, like say, hey, you're putting in referrals for this hip surgery, postpartum, they need this help as well. And so it's just a lot of advocacy, educating these providers on what we can do. And honestly, from an acute care perspective, it's also very much so saving the hospital money. I don't have specific numbers, but Rebecca Seagraves has done research studies that it is really cost effective for hospitals to be incorporating our services. So even coming at it from a monetary component for the hospital from a broad perspective, that's advantageous as well. So I think, it's not that it's not happening in the US, it's just not 100% common practice. It definitely is happening in some hospitals, and hopefully through, work of you guys and other OTs and PTs getting our skill set out there.
Thank you.
Yeah.
Karla, thank you so much for sharing your expertise. We really appreciate you joining us this evening and sharing all of this information. If anyone is interested, BayPath does have 4 OT program options. That includes our on-ground program, our hybrid program, Bridge, as well as our 100% online post-professional OTD. We appreciate you joining us tonight. We obviously welcome any questions. Please refer to the contact information provided here. You can connect with us on social media also. And we really appreciate you joining us tonight. The recording and slides will be shared soon, and we look forward to seeing you guys in the future for the future events. I hope you all have a great evening.
Thank you. Bye.